With stem cell therapy, how I became interested was because of the work I've been doing with fat transfer for many, many years. And when I was doing fat transfer to a patient's leg, she had no feeling in the leg. And the first time I did the fat transfer, I didn't need to use any local anesthetic. The second time, when I came to do a top-up, she said, ouch. And the third time, I had to use local anesthetic because she had regained all the sensitivity in her leg. So that's when I said to myself, why does fat grow nerves? And that's when I started looking into what was in fat. And then I found the work of Patricia Zook, who had done the work at Pittsburgh University in 2001. And shortly after that, I met Professor Bill Walsh at Prince of Wales Hospital, and he was growing bone from fat, and that was pretty impressive to me at the time. Shortly after that, I was asked by some vets to show them how to do liposuction on dogs. And I thought, you know, why do you want to do liposuction on dogs? Then I saw that what they were doing, they were taking that fat and they were dissolving it using an enzyme called collagenase, and they were then injecting it into the dogs to treat their osteoarthritis. I saw dogs that looked totally perfectly normal, healthy dogs who were running around doing everything they wanted to do, nice shiny coats, and the owner told me that 6 months earlier that dog had not been able to get off the floor because the osteoarthritis in the joints was so bad. That's when I really saw that there was enormous power in these cells that come from fat. And that's when I said, well, you know, if we can do that in dogs, we certainly can do it in people. And I told one of my patients about it, and she then hounded me for several months. And so I then went into the literature and did a literature search and looked at all of the other work that surrounded the stem cells, not only the work that Patricia Zook had done in finding the stem cells, but the wealth of work that had been done in animals, in horses, in dogs, and that started in 2003. And by that time, there were thousands and thousands and thousands of cases where the treatment had been proven to be safe in animals and very effective. And it was in 2009 that I treated my first patient, and she had osteoarthritis in her knees, and I injected her knees with these cells, and that's all I did. That's it. That is all I was treating. But she also had rheumatoid arthritis in her wrists, and she had a rotator cuff syndrome in her right shoulder. Both of those things got better. Even though I didn't inject them, I just injected into the knees. And that's when I really started to see the power of what these cells can do. And from there, we progressed into treating other patients, and now have treated hundreds and hundreds of people with osteoarthritis with great success. At the start, our results were around 35% improvements, and that was what we were seeing in the animals. So we were very happy that we were able to get that sort of response in people with the same safety that had been seen in the animals. And what we've done since then is we've improved our procedures and our protocols such that we now get around a 75% improvement. So we've doubled the rate of improvement by making some minor modifications to the way we do things. So that's been very good.